Story 1. I was very intoxicated and took Pepto-Bismol before bed. I woke up with a black tongue, which is apparently a known side effect. It really frightened me. Story 2. I cannot for the life of me remember what the medication was, but several years ago I received an injection at urgent care for an allergic reaction. The injection caused a dimple in the subcutaneous fat at the injection site, which was my right buttock. It looked like a good-sized portion of my buttock had collapsed, creating a noticeable indentation. Apparently, this side effect was quite rare. My doctor excitedly called a few other doctors into the examination room to share in the uniqueness of the rare side effect. That is how I ended up on an exam table with several doctors observing my bare buttock. Story 3. I lost my sense of taste for 40 days once due to a rare side effect of a drug. It was miserable. When I heard that happened to some coronavirus disease patients, I was very sympathetic. Story 4. I took an asthma medication, Singular Montelukast, and I just wanted to kill my ducks for over a year. I felt insane and like I was repressing my true dark self. I told a friend who was also on the same medication, and it clicked for us that we were not informed about this side effect by our doctors. So we stopped taking it, and now I don't feel like killing my ducks. I have much more empathy for people who have those thoughts and repress them. How awful that was. Story 5. After having most of his teeth pulled, my old angry senior cat, who had never sat on me, let alone purred, did both. For the next few days, he did so randomly once or twice a day. On the 5th day, I read the fine print on his pain medication that out-of-character affection was a listed side effect. After the medication ran out, he went back to scowling at me from afar until he passed away years later. To address the multiple questions and direct messages, the drug was buprenorphine. It is meant as a short-term recovery medication. It is not the preferred medication for treating chronic feline pain, so please do not seek this unless recommended by your veterinarian. Story 6. Zoloft makes me sweat through my clothes. At first, it was just at night, but now it happens after very small amounts of physical effort. I am talking about activities like putting laptops away at school and sweat beads down my face. Story 7. Stopping selective serotonin reuptake inhibitors. I remember trying to figure out what was happening in the late 1990s or early 2000s. I could only find a few people who had the same experience. Brain zaps was not a term back then. When I explained it to my doctor, he was stumped at first. Then we talked about me stopping my selective serotonin reuptake inhibitor, and we assumed that was the cause. Now you can find many people talking about it more, but my psychiatrists or pharmacists still do not warn about it. It is awful. I see people talking about quitting their selective serotonin reuptake inhibitors because they are scared of this. I am not a doctor, but it is a bad idea. If it is helping you, then continue taking it every day. All 3 of my children take selective serotonin reuptake inhibitors still. They know the risks, but the benefits are better. Story 8. I was on Ultram for quite some time. Then one day, about 45 minutes after taking a dose, I experienced complete voluntary muscle paralysis. I was sitting in a chair, my elderly mother sitting across the room from me, and I could not move. Heartbeat, breathing, and blinking were just fine. I simply could not move. My mother often suffered from falls, and I remember sitting there terrified, thinking that if she fell, had another heart attack or anything else happened, I would just sit and watch it. The paralysis wore off after about 2.5 hours. I never took Ultram again. Story 9. I take Seroquel at night, and sometimes when it starts working, I hear voices. It sounds like someone has the radio on in another room. I can hear speaking but cannot make out what is being said. My psychiatrist thinks it is very unusual and it is not a known side effect. Story 10. Pharmacist here. My favorite reaction, which is oddly specific, is a burning sensation in the anus with intravenous dexamethasone steroid administration. Story 11. 1 gabapentin helps with some nerve pain. 2 of them ease my anxiety. 3 of them increase my sex drive to the point that I feel out of control, like raging. Story 12. Really intense dreams on sertraline, like epic movie-style dreams with fascinating plots. It is kind of cool. However, what is not cool is all the yawning. Story 13. I was once on a medication that gave me an intolerance to carbonation. Everything fizzy tasted flat to me. It was bizarre. Story 14. Intensive intravenous antibiotics. I knew you could get fungal infections as a side effect, but no one told me it could be esophageal. I thought I was having a heart attack at my high school graduation rehearsal and had to be taken to the emergency room in an ambulance. The emergency room doctor told me it was a muscle twinge and sent me home. I had to go back to the specialist who diagnosed my rare bacterial infection, Lemierre syndrome, to get a correct fungal infection diagnosis. Thanks, Dr. Alter. Story 15. I took trazodone to sleep. I slept very heavily, but I had vivid, intense nightmares that left me distressed as soon as I woke up. This only happened when I took the medicine. Story 16. I took 1/4 of a Xanax, my first ever dose, while staying at a hotel on a business trip. I experienced severe, intense, very real night terrors. I was terrified and was glad the windows did not open. I never took another dose. Story 17. I take escitalopram and it makes me highly heat sensitive. Anything above 72 degrees and I am miserable. It also makes me take longer to finish in the bedroom, but I am considering that one a benefit. Story 18. When I receive opioids at the hospital, I start asking everyone who comes into the room to tell me about their favorite band, and then I compliment their taste no matter what they say. I don't really remember doing this, but my sister has seen me do it so many times that it is clearly a thing with me and that medication. Story 19. When I took bupropion, also known as Wellbutrin, for the first time, I briefly lost the ability to communicate in my non-native language. I was having issues finding words in general, but when my aunt called me on the phone, I literally could not find the words to communicate with her. Felt like a sign of disrespect. Story 20. Taking too much ibuprofen for an extended period can cause ringing in the ears. I learned this after undergoing a lot of consecutive dental work. Story 21. I took tramadol for pain relief because I cannot take oxycodone. I did not expect to feel okay, not good, not bad, just fine. Apparently, it has antidepressant properties. It was a surprising way to discover that I have depression. Story 22. Waking up drenched in sweat as if you ran a marathon in your sleep. Nobody told me that was a thing. Also, super vivid dreams that feel more real than actual life. I would wake up emotionally wrecked over something that never even happened. Medications really mess with reality as if it is optional. Story 23. I took Ambien and Lunesta without anyone telling me that I would just call up a guy I had been chatting with and invite him over to watch a movie and get intimate. Later, I had little memory of it. I know it is a side effect listed on the bottle, but I did not read that. Edit. I did not take them at the same time. I took them at different times but had similar experiences with both. Story 24. I took venlafaxine for a while. The first night I took it, I had a terrifying dream I can only describe as demonic. A friend's sister also started taking it and had a dream she would not talk about. She told her doctor she was never taking it again. Story 25. Medications can sometimes have the opposite effect, which is called a paradoxical reaction. Benadryl and Lortabs make me feel energetic, and I just discovered that Valium also gives me a boost of energy but makes me extremely angry. These reactions are not typical. I have attention deficit hyperactivity disorder, so I wonder if that is a risk factor for this type of reaction. Story 26. The gas they gave me before they put me under for some dental surgery. I had had the gas before at another dentist with no issues, but something was different this time. I was lying there, getting all relaxed and thinking something like, "This is so relaxing." Then I thought, is this what it feels like to be dying? Oh no. Oh no. I calmed myself down and relaxed again. I told myself, this isn't so bad. Then the thought became, that's what they want you to think. Oh no. Oh no. That cycle repeated many times before some lucid part of my brain just said, stop it. Story 27. The shakes after an epidural. The nurse told me I was shaking like I did after giving birth because of the epidural. Pre-warning would have been helpful. Story 28. I have never had morphine before until recently. I am currently on it due to pain, and the effect of the morphine is not pleasant at all. The sensation of being medicated is very uncomfortable. I can literally feel my heart slow down. It is just a very strange feeling. Story 29. I was a cartoon artist. I lost the ability to draw when I started my current medication a few years ago. I am quite upset about it, and I think it is definitely strange. Story 30. May cause dry mouth can also mean to lose many teeth because gum line infections cause hidden cavities below the gum line, which means you do not know you have a cavity until one day the tooth breaks off below the gum line. Story 31. No one tells you that after chemotherapy, mosquitoes and other flying insects can no longer smell you as food. I tell everyone I know who gets cancer this so that in those dark days when you prefer death to any more treatments, they have this little silver lining to think about. Story 32. Withdrawal from over-the-counter decongestant nasal sprays like Afrin causes severe congestion. This commonly leads to a cycle of use and addiction. Story 33. They put my mom on ketamine to fix her leg. When it hit her, she gasped and then held her breath. Freaked us out. The nurse said she would feel loopy. I told her about it. She said the entire room exploded into video game blocks mixed with a few other games. She said she was in such awe that she instinctively gasped and then held her breath. There is nothing like hearing the nurse say, "Ma'am, breathe. Ma'am, quit holding your breath. Hey, ma'am. Ma'am, breathe. Name, breathe. Open your mouth and breathe." And seeing two additional nurses in the hallway run into the room to help. I was told that whatever they used on me to knock me out for wisdom teeth removal actually put me completely under, not just laughing gas. When I woke up, I wasn't aware at first, but I am meticulous about reading medication instructions and side effects. Apparently, I was reading them with moving eyes, asking detailed questions. I read the bill and remarked on different items because they had to do bone grafts too. The surgery lasted 3 hours. I was awake for 2 more hours before being released. An hour was spent discussing medications. I then sat in the car for nearly an hour while my mom got my medications. I came home, crawled into bed, and slept for 8 to 9 hours. I woke up in tears because of the pain and asked my mom if I had any medication. She said, "You didn't take them?" I said, "No, I don't even know if I have any." She then told me the whole story and how shocked the doctors were that I was so awake, lucid, and normal. Surprise, I wasn't actually there. Story 34. Clonazepam. I took it for anxiety back in 2020. It worked fine, but then one day I blacked out. I couldn't remember how I got home from work. I woke up, and it was around 8 p.m. It worked fine for a couple of weeks, and then it happened again, this time on a weekend. I ran errands like shopping but did not drive. I lived in New York City. I woke up with no memory of the day. I threw the rest out and will never take it again. Story 35. Benadryl has never made me tired. It makes me extremely hyper and jittery. I have not taken it since I was in my early 20s because I do not like how I feel on it. Yesterday, after a 75-day migraine, I had a migraine cocktail which included Toradol, Reglan, and Benadryl. I was desperate and thought maybe the Benadryl would not affect me like it used to, since I have not tried it in 20 years. I lay down to try to nap, but my body felt like I had the creepy crawlies. My migraine is finally gone, hopefully for a long time. Story 36. Antidepressant escitalopram. I knew it is very common to have sexual dysfunction, but I had a consistent erection for weeks. It did decrease over time. Story 37. Amoxicillin makes me suicidal in a very matter-of-fact way. The first time I was prescribed it, I noticed within 3 days that I was making a plan, which confused me because I was not depressed at the time. I told my partner, saying, "I think this medication is making me suicidal." He told me to inform my doctor immediately. I called and spoke with a nurse, asking her to have my doctor prescribe something else. At first, she did not believe me, but they gave me a different medication. The next time I needed antibiotics, the doctor said they were prescribing amoxicillin. I said, "No, that makes me suicidal." She shut me down, saying that was not possible and prescribed it anyway. Sure enough, 3 days in, the feeling returned. I called and had it switched, asking them to put in my chart that I am allergic to it. They said suicidal thoughts are not an allergy. Later, I got a new doctor who wanted to put me on amoxicillin. I explained my experience. She said, "That's interesting. I've never heard of that. We'll try it, and if it happens again, I'll label you allergic." Of course, I called and asked to be taken off it. She prescribed something else immediately. I researched this issue and found out it is a known, though extremely rare, side effect. Other cases exist. The doctor added to my chart that I am allergic to amoxicillin, confirming it is an allergy, just an unusual one. Story 38. If I recall correctly, lisinopril for high blood pressure caused an annoying dry cough. I had it for months before a coworker asked if I was taking it. Story 39. My body is unusual. Unfortunately, I have developed a list of strange side effects. Birth control affects me negatively. The ring-style birth control made me vomit daily. Another type, which I cannot recall, caused painful hives from sun exposure. I have tried several others with various side effects and eventually gave up. Wellbutrin caused, to put it politely, anal leakage. Lamictal caused a rare reaction called Stevens-Johnson syndrome that nearly killed me. There may be more, but at this point, I am extremely careful about what medications I take. Story 40. Akathisia from antipsychotics is the worst feeling ever. I almost killed myself a few times experiencing it. When it was really bad, I also experienced oculogeric crisis, which is involuntary upward eye movement. I had never heard of akathisia until I kept trying to look up side effects after my third medication trial, and it got worse. Causes intense inner restlessness, constant and unbearable. I wish this upon no one. I have been through many medication changes, but I think I found the perfect one for me. Now I only have slight symptoms, but none as bad as before. I am still in support groups for akathisia, and I try to help anyone I can who experiences this horrible, debilitating side effect. Story 41. I know this is simple, but I am tired of not being able to take an antibiotic without getting a yeast infection. Story 42. Synesthesia. One medication I was on after surgery made me hear colors and taste music. It was the strangest thing I have ever experienced. I had to cover up a painting in my living room because it felt so loud. The colors were not bright. They were just loud and cacophonic. I tried listening to some music. That was worse. I could hear the notes, but I could taste them too. Story 43. I took a medication called ivabradine and experienced a very unusual side effect that gave me strobe-like vision in the dark. I would see after images of everything I had looked at very strongly, to the point where I could not see where I was going or what I was doing in the dark. Fortunately, these effects went away, but it took about 4 weeks. Story 44. Experiencing vivid dreams from medications that were never intended to affect sleep, with full movie-level storylines. No one warned me. Story 45. I was given gabapentin for nerve pain. I took it for about 2 months until I did some strange things. I poured myself a glass of tea from a pitcher, and instead of putting the pitcher back into the refrigerator, I poured the tea into the garbage can. At work, I was writing a few notes on paper with a pen. Instead of writing sick, I wrote isk. The medication scrambled my brain, and I stopped using it. Story 46. When I was on duloxetine, I couldn't handle heat. Any temperature above 75 degrees Fahrenheit, I was absolutely miserable. Entire summers feeling perpetually stuck in heat exhaustion. Days and days with no sleep because it was a little too warm in bed, even with fans on, windows open, and cooling blankets. I switched back to fluoxetine now for other reasons, and my heat tolerance has increased by about 10 degrees. I can be in 80+ degrees Fahrenheit heat and not feel like I'm dying. I only need to drink 1 sports drink a day if it's above 90 degrees Fahrenheit and I'm staying inside. Selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors both affect thermoregulation, most commonly by changing the body's electrolyte balance and causing you to urinate out salts that you should be sweating out. Then your sweat won't cool you correctly, and if you drink plain water, you end up with electrolyte imbalances plus overheating. It's not a fun experience, and only recently have doctors discussed it. Story 47. Not being able to taste carbonated drinks on Topomex, Trokendi, or Topiramate. I told several restaurants that their soda machines were out of syrup before I realized the cause. Story 48. Discontinuing antidepressants is similar to stopping narcotics. You can experience withdrawal symptoms when you stop taking antidepressants. Story 49. I took Cymbalta when it was fairly new. Nobody told me a side effect was acute amnesia episodes, and that they might not go away just because I stopped taking it. If I get highly stressed, I still experience an episode. Story 50. Totally blanking on the name, but a while back my doctor put me on a new medication. He told me I would not get a headache, but I would feel like there was boiling water sloshing around in my head. He was right. Story 51. Fetsima. The anger I experienced while taking it was intense. My road rage was terrible. Normally, I cannot stand the drivers where I live, but I wanted to ram into them repeatedly. I was snapping at people constantly. It was absolutely horrible. I am usually a calm person. Story 52. When I first started taking progesterone, it made me go into a drunk-like state. Drowsy, dizzy, and disoriented. I told my obstetrician, and she said that it happens to some women. Story 53. Mood stabilizers. I didn't think they would knock me out, make my body and face feel numb, and overall make me feel like I'm not real. Story 54. This was a few years ago, so I do not remember the medication or why I was on it. My guess is that I had an ear infection or something similar. Anyway, the medication made my skin very sensitive to sunlight. It actually felt like burning to be in the sun too long. I worked as a seasonal employee for parks at the time. I was literally outside 8 hours a day for work. A warning would have been nice. I am pretty sure I stopped taking the medication early. Story 55. You would be surprised at how many commonly prescribed medications have strong links across multiple studies to dementia. Some types of medications include certain antidepressants, drugs for urinary incontinence, and sleep aids. Always check and do not assume that your doctor is informed. Mine was not. Story 56. I started a new antipsychotic medication at an extremely low dose and thought nothing of it. At Christmas with my family, my sister told me that I looked yellow. I went to the emergency room because jaundice is serious. It turned out that the medication has an extremely small chance of causing pancreatitis. I was unfortunately one of the few for whom that happened. Story 57. The benzodiazepines I got for panic attacks were notoriously hard to stop because of extreme rebound anxiety and insomnia problems. You need to very gradually wean yourself off them when you stop. I am talking about taking 2 months and reducing the dose to a tiny crumb by the end. It will be a total difficult experience. Story 58. When I was a child, I got a severe wart infection on my feet, likely from the swim team showers. It was so intense that I had over 60 warts on each foot, and my pinky toe was completely covered with several warts. Nothing worked on these warts. Not duct tape, not wart solution. They could not freeze them off without damaging most of the skin on my feet. Medical professionals took many pictures for medical journals but were unsure how to treat the infection. Then someone suggested a medication for high cholesterol that, for some reason, had a side effect of clearing warts. My parents agreed, so I became probably the only 8-year-old taking 5 cholesterol medication pills a day. The treatment cleared the wart infection. Story 59. Morphine makes me flirty with everyone. It does not matter the gender or even life status. I even flirted with the intravenous pole. Story 60. I used to drink too much almost a decade ago at this point. When I was deep into it, white noise sounded like people talking. The fan, running water, it all sounded like people whispering. Any corner of furniture caused physical pain to look at. I had to literally turn away or I felt like I was going to smash one of my eyes into it. I never did, and it took years to fade after I stopped drinking. The intense fear was so visceral. Story 61. I was on some type of medication when I was 16, and it made me fully lactate. I had never been with a man before, and I was so confused about why milk was literally spraying out of my breasts. Story 62. Ambien. On the first night, the fireplace seemed to be talking to me. I guess I did not go to bed as I should have. On the second night, I took the medication and went to bed. The next thing I knew, I was outside talking to my cousin. I stopped taking the medication with my medical doctor's approval. Story 63. After reading some of these, mine seems tame, but it was funny. One of the many times I had kidney stones, my doctor prescribed oxycodone. I dreamed my sister, who is deceased, and I were shoe shopping in the mall parking lot. There were racks and racks of shoes. Suddenly, someone screamed and pointed to the sky. There was a giant chicken flying, and we knew it was trying to get us. We ran and got on a bus. There were people everywhere screaming. The chicken lifted the top off the bus. And that's when I realized the chicken was made entirely of Charms grape blow pops. I pulled one of the blow pops out and the chicken fell apart. Everyone was so happy. We went into the mall, which was dark and deserted, and started sliding down the banister of a regal-looking staircase. We were all laughing, running up the stairs and sliding back down the banister. I was also on a muscle relaxer once. I usually only took it before bed. My back was really hurting me at work, so I took one. Felt like I was intoxicated. I fell out of my desk chair. Luckily, it passed in about an hour. Story 64. I am on a non-stimulant medication for my attention deficit hyperactivity disorder. It made my urine smell very unpleasant. I have to hold my nose when I urinate because it is that bad. Story 65. I can't remember the name of the medication, but there was an antidepressant my psychiatrist prescribed a while ago that could cause a rare condition which could be fatal if it became severe. Luckily, I stopped taking it immediately once I noticed the early symptoms, a rash on my chest, and informed my psychiatrist right away. He said the rash would go away once I stopped taking the medication and advised me not to worry unless I experienced other symptoms. The rash disappeared quickly, and I did not have any additional symptoms, so I was fortunate. Story 66. If you are in the small percentage of people with unusual metabolisms, sertraline, usually prescribed for anxiety and to calm you down, will instead speed you up. I had a few friends who took it, and each one had to take it in the evening because it made them very sleepy. I first took my dose, starting at 50 milligrams in the evening as recommended. I spent the entire night with every muscle so tightly clenched that the next day I was sweating heavily onto the sheets and had sore muscles for several days. Luckily, I did not have an anxiety attack. To this day, 7 years later, I take 25 milligrams in the morning. I no longer feel sped up, but I definitely do not need more than 25 milligrams to keep the edge off. Story 67. I developed lupus from an acne medication I took as a teenager. I went from being very active to not even being able to shower by myself within a few weeks. Story 68. I once took a beta blocker for anxiety. One of the side effects listed was sudden death. I will never take that medication again. Story 69. Nobody warned me that starting sertraline, the medication with the sad little blob commercials, had another nickname, the marriage ruiner. I started sertraline, and my marriage ended within 6 months. Thank God I got out of that, and the antidepressants helped me see my horrible situation. Story 70. I had a drama instructor in her 80s who almost died because her pharmacist failed to warn her about ingesting citrus with her hypertension medication. She ate half a grapefruit every day for a week and then collapsed one morning from medication toxicity. It took her more than a month to recover and be able to walk and work again. Story 71. Chest pain and damaged veins while on birth control. I was 18 when I first started taking the pill, orthotricycline low. My mom was the first to notice that my veins looked unusually blue. I didn't think much of it since they didn't hurt. Then spider veins began to appear. After that, I started experiencing chest pain and pain in my left arm. Sometimes I would wake up and could see all the veins in my body prominently. I went to my doctor and told her about this, but she dismissed my concerns and told me to continue taking the pill because we only worry about deep vein thrombosis. I assumed the chest pain was not serious. After that appointment, I stopped taking the pills. The chest pain stopped, but I developed a varicose vein in my leg, which I have only recently started treating. I have asked other doctors about this, and no one has ever heard of birth control causing this effect. Therefore, I now avoid hormonal birth control altogether. Story 72. My anti-rejection medications cause me to lose hair in unusual places. My calves are mostly bare, and my back loses hair in cycles like farmland. Thankfully, the hair on my head remains unaffected. Story 73. When I was young, I was put on fluoxetine. This was in 1990. It was still considered a wonder drug. It helped everyone except me. The next 4 years were absolute hell. The thoughts and attempts were unrelenting. Getting off fluoxetine was no picnic, but I am a lot better without it. Story 74. Dry mouth can lead to cavities. It is a very uncomfortable experience. If possible, consider getting a genetic panel done. It can help avoid trying multiple medications. Story 75. Some selective serotonin reuptake inhibitors caused me unusual vision problems. The notes mentioned blurry vision, but what I experienced was a fluctuating depth of focus. It felt like I was focusing just in front of objects and then just behind them, never directly on them. Story 76. I was on blood pressure medication when I was in my early 20s. When I started dating a girl and things got serious, I discovered the unfortunate side effect that they made me unable to climax during intercourse. We had several stressful events before I ran out of medication over a weekend and did not refill them. Suddenly, the side effect was gone. 10 months later, my daughter was born. Story 77. My whole life, I constantly had a song stuck in my head, a soundtrack of music for every waking moment, until I started taking Lexapro, and the music completely went away. Now my head is so quiet, and it feels strange. Story 78. Not a medication, but I am in the process of getting sober, and something I had never heard of is the intense craving for sweets you experience. I thought I was losing control, but apparently it is very common. Story 79. Zyrtec treats itching, but withdrawal from Zyrtec causes intense itching that can last for months. I was unfortunately a victim of this vicious cycle. I joined a group of Zyrtec withdrawal sufferers and helped others try to stop using it. I advise no one to ever take it for anything. Do not risk it. Generic Claritin works fine, and I experienced no withdrawal pain from it. This is not a weird issue, but a serious warning. Story 80. Cytotec, misoprostol, was supposed to soften my cervix and open me up to make a dilation and curettage easier when I miscarried at 8 weeks and my baby was not passing, putting me at risk for sepsis. My doctor told me to expect period cramps. Instead, I went into full labor at 13 weeks with uterine hyperstimulation for 4 hours straight, became hypoxic, and ended up in the emergency room. My next doctor told me she had stopped prescribing Cytotec a decade earlier because of all the horror stories she had heard. It only happens to a low percentage of people, but it was deeply traumatic and very dangerous for me. I experienced silent labor in my next successful pregnancy, so I feel like that was my body's way of saying, "You already did this once and did not even get a baby out of it, so we are giving you a break." My experience with Cytotec is likely directly related to my subsequent placental abruption. During that silent labor, I never experienced labor pains, but the placenta detached mid-labor and had to be delivered via cesarean section several days after her due date because the contractions were weakening the placenta. The doctor then highly discouraged me from attempting a vaginal birth after cesarean due to the damage, so my next surviving baby was also delivered by cesarean section. If you have your heart set on a natural childbirth, I absolutely want to warn you to avoid taking misoprostol for any reason. Story 81. I cannot recall the name of the medication, but one medication I took made it difficult to urinate. I would sit and try, but it required effort. It was very annoying. Story 82. My doctor warned me about loss of sexual desire when I started taking Prozac. What she did not tell me was that risperidone would cause significant sedation. I also recently learned that melatonin is most likely the cause of my nightmares. Story 83. Modafinil and armodafinil make your urine smell unpleasant. Metformin tablets have a smell similar to air released from a bicycle tire. Story 84. Nobody warns you about finasteride for preventing potential hair loss before it happens. Apparently, for a very small number of people, though they are not sure exactly how many, it has a serious side effect. It can completely destroy your sex drive. Flat. Nothing. Prepubescent levels of libido. You cannot feel a single bit of sexual interest or desire. It may be permanent. They do not know what causes it or why. For me, I went from having the highest sex drive of anyone I know, consistently since puberty with 0 periods of low or no sex drive, even during long bouts of depression and attempted suicide, to suddenly having none within months. Keep in mind, the physical function still worked. The drive was just gone. There was no sexual feeling at all. After over a year of trying various things, researching potential theories, doctors' research, and possible treatments, and trying them on myself without medical direction or approval, I finally found something that worked for me. It was a drastic recovery, and while I am not certain it is 100% better, I know it is significantly better than it was. If you value your sex drive and do not want to risk losing it for the potential prevention of hair loss, avoid finasteride. That is all. Story 85. Not medication, but for your information, whitening toothpaste can permanently erode your gums, exposing nerves that can be painfully sensitive to temperatures. Story 86. I received oxycodone after a joint replacement. That night, I took one to help me sleep. Instead, I spent the next 5 hours with excruciating pain in my thighs. It felt like my legs had been amputated. The next night, thinking the oxycodone was not at fault, I took another one. The same horrible result occurred. I avoided all painkillers for the rest of my recovery. The residual pain from the healing joint was far less problematic than the medicine. Story 87. Remeron caused me to eat in my sleep, have very bad dreams and night terrors, and gain 35 pounds in less than 90 days. Story 88. My daughter has schizophrenia. She tried one medication that stopped her periods and caused her to lactate. She was 17 at the time. She came into my room terrified that she had breast cancer and was crying. Story 89. When I took a selective serotonin reuptake inhibitor, the brain zaps were worse than my situational depression. They seemed to be common, but no one warned me and I thought I was dying. Story 90. About 15 years ago, I took doxycycline for a cat bite. After a few days, I started to feel really strange. It was not a physical symptom like nausea or headaches. I could not put my finger on it, but I just felt off. So, I decided to look at the pamphlet the pharmacy gave me and check the side effects. One of the rarer side effects was loss of sense of self. That was the only time in my life I did not finish a course of antibiotics. Definitely the strangest side effect I have ever experienced. Story 91. There is an antidepressant that actually lowers your body's natural defense against seizures. Check and double-check all side effects of your medicine. This one is real. Although I was not directly affected by it, a family member was. The family member started having seizures, and we backtracked after many tests. That, my friend, is the weirdest side effect I have ever known. Story 92. I take venlafaxine. It wasn't until I was on a decent dose, 75 plus 37.5 milligrams extended release, and my psychiatrist literally quit on me, leaving me almost a month without my medication, that I found out about the withdrawal. Venlafaxine is rated as one of the worst mental health medications to withdraw from. There is an iconic brain zapping sensation that feels like an electric shock going straight to your skull and brain. There is nausea and binocular vision, where your sight zooms in and out at random. There is the inability to eat without pain and diarrhea. And then, of course, the emotional side effects. I felt incredibly sad, empty, and angry all at once. I had thoughts of killing myself, breaking up with my boyfriend, and punching family members. I ended up curled up in a ball on my bed for the first few days, unable to work, eat, drive, or sleep. All I could do was cry. It was horrible. I am now on a maintenance dose of 37.5 milligrams of venlafaxine and still working with my current doctor to wean off it, so I never experienced that again. When starting medications, or if you are a doctor prescribing medications to mental health patients, please discuss withdrawal. If you are starting a new medicine, research the withdrawal and side effects. It is much easier to understand from other people's experiences than from long medication forms, as I do with every new medication. Story 93. I dislocated my shoulder twice and had to be put under both times for the doctor to put it back in. The first time, the doctors used general anesthesia, and it felt like a routine procedure. The second time was at midnight, and I had just eaten dinner. The doctors told me they would give me something else to put me out so we would not have to wait hours for anesthesia. At the last second, the doctor told me it was ketamine. Right before he injected me, he said some people report having strange dreams while under. I thought, oh boy, I know what is coming. Sure enough, I experienced a full dissociative state. I was gone from reality, spinning down a vortex of intense music and loving thoughts. I loved every second. I came back to reality, and my shoulder was back in place. I never felt a thing. Story 94. The first 1 to 2 weeks I was on sertraline, food just stopped tasting like anything. It was so bizarre, and thankfully I have not had it happen since. Story 95. When I was in China, I was dealing with an unknown intestinal disorder that made it almost impossible to eat. All I could have was rice congee for months. I experienced intense stomach pain and vomiting, and if I managed not to vomit, I had intestinal pain for hours afterward with constipation like knives. My boyfriend at the time took me to a more Western-style Chinese hospital where they told me I should try an injection of something they said was a type of saline that helped with digestion. They did not tell me that the dosage was very specific. After the injection, which they administered in my thigh, I attempted to walk out of the hospital and started to black out. I remember my hands becoming very numb and cold, and I said, "I'm not okay," a few times before losing consciousness completely. I woke up later, not sure if it was 15 or 30 minutes, on a stretcher with an oxygen mask and a doctor shining a light in my eyes. When I asked what happened, I was simply told, "They gave you too much," and that I could leave once I felt ready to get up. Then he left. It was very strange. Story 96. Risperidone caused me, a teenage girl at the time, to produce breast milk. The doctor immediately discontinued the medication. Unfortunately, the same issue affected many boys, leading to a large class action settlement. Story 97. I was on clonazepam for almost 13 years. It took me a year to wean off, and that was not without complications and suffering. I have been off it for 17 months, and since then, I have experienced Bell's palsy that never recovered, electric shock sensations, insomnia, suicidal thoughts, homicidal thoughts, the worst brain fog I have ever known, paranoia, and more. These effects are never meant to last more than 4 weeks, and I was on a heavy daily dose. I am now afraid of taking any prescription medication and trust no doctor. Story 98. Some antibiotics give me yellow splotches on my skin. There is nothing wrong with my liver. It is just a strange skin condition. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.